Good morning, students. Today our topic is cardiac cycle. The series of events taking place inside the heart as a result of impulse production by SA node or sinoatrial node is known as cardiac cycle. The normal heartbeat of a person, that is 70 to 75 times per minute. One cardiac cycle is about 60 by 72, that is 0.8 second between two successive cycles. One cardiac cycle time period is 0.8 second, that is divided into three parts. The complete cardiac diastole, atrial systole and ventricular systole. Here the systole means contraction and the diastole means relaxation. The complete cardiac diastole means it is also called a joint diastole. It takes 0.4 second. In this part, the heart completely relaxed and inside the heart there will be negative pressure. As a result, the blood enters to the heart, bicuspid and tricuspid valves are open and 70% of the ventricle filling during this joint diastole. After that, when the impulse produced in the SA node, that result in the atrial systole means atrial contraction, that is for 0.1 second. In this time, the 30% of the ventricular filling takes place. At that time, when the impulse reaches to the AV node, the ventricular systole will take place, that is for 0.3 second. Ventricular systole means the contraction in the ventricle. As a result, the tricuspid and bicuspid valves will be closed and that result in the formation of a sound. This is called loop sound, or this is the fast sound of heart. After that, inside the ventricle there will be positive pressure and that result in the semilunar valve opening. When the semilunar valve opens, the blood ejects to different body parts. As a result, the semilunar valve will be closed and that form a second sound. This is called dop. Here, the bicuspid and tricuspid valve will be open and blood flow to the ventricle again. This is all about our cardiac cycle. This is for 0.8 second. The joint diastole means cardiac relaxation for 0.4 second. Atrial systole, that is 0.1 second, and after that the ventricular systole is 0.3 second. Here every time the NEET also asks the question, what is the fast sound? That is the loop or occurs due to closing of which valve? That is the closure of tricuspid and bicuspid valve, and the doop sound, that is the second sound due to the semilunar valve closing. Okay, this is all about our cardiac cycle. Now, the cardiac output. What is the cardiac output? Everyone knows that about 5 liter to 6 liter blood are pumping in every minute inside the heart. The volume of blood pumped out by each ventricle for each heartbeat is known as stroke volume. What does that mean? It means during each heartbeat, the amount of blood pumped out from the heart is known as stroke volume. It is about 70 ml from right ventricle and 70 ml from left ventricle. The volume of blood pumped out by the heart from each ventricle per minute is termed as cardiac output. Per minute, the amount of blood pumped out from the ventricle is known as cardiac output. But the amount of blood pumped out from the heart during each heartbeat is stroke volume. Then cardiac output can be calculated stroke volume into heart rate. Here the stroke volume is 70 milliliter and the heart rate is 72. That's why this is 5040 ml. About 5 liter blood are pumping each minute inside the heart. Thank you.